A report in January 2019 stated that statistics from World Health Organization indicated that Uganda has an annual demand of about 340,000 units of blood, but falls short by over 100,000 units. World Health Organization recommends that 1% of blood be collected annually from the population. Blood is required to enable doctors carry out life-saving procedures for patients with conditions like severe malaria infections, sickle cell anemia conditions and low blood levels, accident victims, cancer patients on chemotherapy, or those who need resuscitation, women with complications of pregnancy and childbirth, for newborn babies with blood loss or blood complications during major surgery. Why should you donate blood? Human blood is a life-giving and life-saving product of the human body that can only be obtained from human beings to be used in human beings. There is no known substitute for human blood. Blood donors are the only source of blood for patients who need it. What should you know before you donate blood? Donating blood is an incredibly noble cause. Are you eligible to donate blood? Conditions you must fulfill. Overall health. The donor must be fit and healthy and should not be suffering from any transmittable diseases. You cannot donate if you have a cold, flu, sore throat, cold sore, stomach bug or any other infection. You must not have any symptoms of illness within the last 1 week or fever within the last 3 weeks. Age and weight. The donor must be 17 to 65 years old and should weigh a minimum of 45 kilograms body weight. Blood volume is determined by body weight and height. Blood pressure. Acceptable as long as your blood pressure is below 180 systolic first number and below 100 diastolic or second number at the time of donation, or for persons with a low blood pressure. It must not be below 90/50 millimeters of mercury. Medications for high blood pressure do not disqualify you for donating. Pulse rate must be between 50 and 100 beats per minute without irregularities. Hemoglobin level. A minimum of 12.5 grams per deciliter is required. If you have recently had a dental procedure, a tattoo or body piercing, you cannot donate for at least 6 months from the date of the procedure. The safety of the blood donated and the donors requires a combined vigilance of both the potential donors and donation collection team to ensure that the product and the future well-being of the donors is maintained. What then should our teachers and school administrators ensure? Please notify the students of a planned and scheduled blood donation event well in time so that they can be prepared for it. Please ensure that you report on the status of your students following their last donation visit to update the team on their last performance. Ensure that any additional information that you might have about a student who wants to donate blood that is pertinent to blood donation is delivered to the team in time. Ensure that the students get the required counseling and after-donation care. Please ensure that the donation collection team that visited the school the last time comes back with the results on blood group testing, as well as the blood test results done for the students who donated the last time. What should the students know? Ensure that you qualify to be a donor as per the conditions stipulated, and please ensure you answer truthfully on the health assessment questions asked, because they are asked for yours and the recipient's safety. Ensure that you have some form of identification document, like an ID, and for previous donors, your donor card for easy access to your donor test results and donor history records. For previous donors, ensure that the appropriate interval of time has passed since your last donation. Men can donate safely once in every 3 months, while women can donate every 4 months. For females, please ensure that your menstrual period is recently past and not looming soon ahead. Those with heavy menstrual flows and episodes of headache or dizziness after their periods are advised to inform the donation health nurse for proper assessment. If you have missed a period and suspect you might be pregnant, refrain from donating blood. Before your blood donation, get plenty of sleep the night before you plan to donate. Eat a healthy meal before your donation. Drink plenty of water before the donation. It is best to avoid coffee and caffeinated beverages before donating. Wear a shirt with sleeves that can be rolled up. Before donating blood, try to avoid the following: alcohol. Alcoholic beverages lead to dehydration and marked side effects like headaches, dizziness, and fainting. Fatty foods. Foods high in fat, such as chips or ice cream, can affect the tests that are run on your blood. Iron blockers. Certain foods and beverages like tea and coffee can affect your body's ability to absorb iron and interfere with your recovery process after donation. What can you expect? Before you can donate blood, you will be asked to fill out a confidential medical history that includes questions about your behaviors known to carry higher risk of blood-borne infections, infections that are transmitted through the blood. Because of the risk of blood-borne infections, not everyone can donate blood. The following are a few high-risk groups that are not eligible to donate blood. Anyone who has used injected drugs, steroids or another substance in the past 3 months. Men who have had sexual contact with other men in the past 3 months. Anyone who has had a positive test for HIV. Anyone who has engaged in sex for money or drugs in the past 3 months. Anyone who in the past 12 months has had close contact with, lived with, or had sexual contact with a person who has viral hepatitis. Anyone who has had babesiosis, a rare and severe tick-borne disease, or the parasitic infection Chagas disease. You will also have a brief physical exam, which includes checking your blood pressure, pulse, and temperature. COVID-19 concerns. The virus that causes coronavirus disease 2019 hasn't been shown to be transmitted through blood transfusions. However, the US Food and Drug Administration suggests waiting to donate blood for at least 14 days after a positive diagnostic test for COVID-19 without symptoms, or for at least 14 days after symptoms of COVID-19 have completely cleared up. Those who have tested positive for COVID-19 antibodies but didn't have a diagnostic test and never developed symptoms can donate without a waiting period or having a diagnostic test done before donation. If you get a non-replicating, inactivated or mRNA-based COVID-19 vaccine, you can donate blood without a waiting period after your blood donation. Drink extra fluids. Avoid strenuous physical activity or heavy lifting for about 5 hours. If you feel lightheaded, lie down with your feet up until the feeling passes. Keep your bandage on and dry for the next 5 hours. If you have bleeding after removing the bandage, put pressure on the site and raise your arm until the bleeding stops. If bruising occurs, apply a cold pack to the area periodically during the first 24 hours. Other questions you might have about blood donations. How much blood is maximum donation? It is generally accepted that the volume of whole blood donated should not exceed 13% of blood volume. Can I donate blood every month? A person can donate once every 3 months, but not more than 5 times in a year. Do blood donors live longer? They have found striking evidence that men who donate blood are far less likely to have a heart attack than those who are not blood donors. Is it bad to donate blood on an empty stomach? The first and most important rule: never donate blood on an empty stomach. Eat a wholesome meal about 2 to 3 hours before donating. How long will it take to replenish the pint of blood I donate? Your body will replace the blood volume or plasma within 48 hours. It will take 4 to 8 weeks for your body to completely replace the red blood cells you donated. What are the nutritional requirements for regular blood donors? If you are a regular donor, you are permitted to donate blood once every 3 months. Zero in on iron-rich foods like beans, sweet potatoes, maize, cassava, sorghum, dodo, bananas, eggs, liver, tomato juice, and others. Make sure you include some vitamin C-rich foods too in your diet, which help with the absorption of iron. Proper hydration is essential too. So tank up before you go to donate. Have 3 to 4 glasses in the 2 hours before you go. There's a reason why they offer drink and some biscuits after the donation. Please have them. It is important to hydrate and refuel a bit with a high sugar snack before you rush off. The juice, water or oral rehydration solutions help replace the loss of fluid due to blood donation. Continue drinking plenty of fluids for the next 24 to 48 hours to prevent low blood pressure. You are advised to avoid caffeinated drinks such as colas and coffees for the next 8 to 10 hours, since caffeine is a diuretic and causes loss of fluids from the body.